Module 4 Charting. In this fourth module, we will give you an overview of the progress note and take you step by step how to chart in CareLink San Francisco. By the end of this video, you will be able to understand the functionality of the patient dashboard and right chart panel, be familiar with the layout of the progress note and the different ways to navigate within the progress note, be familiar with the different charting options within the progress note. The progress note can be accessed from the patient hub, or from the office visit screen. From the office visit screen, double-click on the patient or highlight the patient and click View Progress Note in the lower left corner. On the top, we see the patient dashboard. Patient's demographic information will appear over here. If the clinic is using photos, their photo will appear here. Next to their name, age, and gender are three buttons that will take you to Patient Lookup, Patient Info or Demographics, or the Patient Hub. If the patient has allergies or some kind of alert, allergies or billing alert will appear yellow with a red check mark next to it. Next on the patient dashboard are these brightly colored squares known as sticky notes. The orange sticky notes contains the patient's birthday, primary care physician, primary language translator. If recorded, it will also contain the patient's height and weight. The green sticky note is for insurance information. Currently, that's not being utilized by DPH. The yellow sticky note can be edited. Some clinic workflows use the yellow sticky notes as a way to communicate at a particular visit. For example, an MEA who does chart prep may know that a patient needs an immunization at their visit. They can write that in a sticky note and the provider will see it. Yellow sticky notes can be viewed from the progress note but are not part of the legal document. Yellow sticky notes are carried over from one encounter to the next. They should always be used with caution as it's not always clear when the information was entered. The secure note sticky note is used for sensitive information. Only those with particular settings can write or read information in the secure note. The last sticky note is the advanced directives, and if a person has advanced directives, this is where that information will appear. Next on the patient dashboard are the quick links. Many of these links are the same ones that you'll find on the patient hub. From here, access the medical summary, the CDSS alerts. CDSS stands for Clinical Decision Support System, and this feature will generate alerts based on patient demographics and diagnosis. We have both generic and patient-specific alerts from the alert screen. This screen is where you can also access health maintenance. The health maintenance screen is where you can view what labs or diagnostic procedures were done and what might be due. Information here will be automatically populated from CareLink San Francisco charting, but if somebody is coming from another facility, it can also be hand entered. Labs, diagnostic imaging, and immunizations can be accessed from this screen for easy reference and charting. Access labs, diagnostic imaging, procedures, and you can access a growth chart from here. The immunization screen can also be accessed from here. A list of encounters, patient documents, flow sheets, and notes. Many of these things we'll be discussing in much greater detail at a later time. SF stands for Smart Forms. These are questionnaires that have been built for DPH. For example, the PHQ-9 screening questionnaire. This pull-down menu here is empty on this patient, but this is where if there was another patient, for example, a family member that was related to this patient, their name would be here. The provider could then easily access their chart. The next pull-down menu, bulleted or default, just is a way to format the progress note. So right now it's in bulleted format. Default makes it more paragraph form. And then the pull-down menu here is for encounters. As we said before, encounters can be in person or they can be virtual via the telephone encounter. So when I use the pull-down menu here and if I see a red T, that means it's a telephone encounter, and if it's a V, then that means it's an in-person visit. These arrows also will scroll you through the different visits. The right chart panel contains tabbed sections that provide additional information about the patient. The information in the chart panel carries over from one encounter to the next, making the patient's past relevant information available without ever having to exit the progress notes. The detailed information displays in listed categories identified by tabbed headings. A user can choose up to 5 tabs to display from a total of 7. In addition, a 6th tab, the DTLRA tab, is also available from the right chart panel. Tabs to be displayed are configured in user's settings, something we will assist you with in person. Going tab by tab, the first one is the overview. From here it's possible to view the patient's advanced directives, their problem list, their medication summary that can be grouped by date or medication, their allergies, and their immunization history. Problems from the problem list can be brought over one at a time or all at one time. Click on the ellipsis to edit the problem list. Click on the plus sign to view previous encounters that a problem was used. From the right chart panel, medications can be continued, refilled, or stopped, and allergies can also be brought into the progress note by clicking on the arrow. The DRTLA tab lists labs, diagnostic imaging, telephone encounters, web encounters, referrals, documents, and actions. Currently, the P2P feature is not available. After the DRTLA tab is the History tab. Access the patient's medical and social history from here. Use the arrows on the right to bring any of that information into the current progress note. The Alerts tab lists patient alerts. OS is for order sets, and these are the user's favorite order sets that they can access easily, and the user's favorite templates that are also easily accessible from the right chart panel. Not viewed here is the Diagnostic Imaging and Labs tab and the CDSS tab. The right chart panel and the patient dashboard can both be hidden by the olives on top. Even with the patient dashboard hidden, patient lookup is accessible as well as links to patient demographics and patient hub. Each progress note has patient information banner on top. Patient demographic information is listed here as well as the patient's primary care provider, the encounter date, the provider actually caring for the patient, and the appointment facility. Briefly, the progress note is divided into subjective, objective, assessment, plan, and billing information. Functions of the buttons on the very bottom of the progress screen will be discussed in a future module. Before I show you how to chart in CareLink San Francisco, I want to discuss the different ways to navigate throughout the progress note. Click on one of the blue headings and a screen opens up where you'll be able to chart. Icons over here take you through the chart, though not necessarily in the same order as the headings. Hover over the icons to see what section they'll bring you to. So the first icon would bring me to allergies. Notice how medical history and allergies are grouped on one screen. The second icon brings me to chief complaints and current medication. Another way to navigate through the charting screens is to click the buttons on the bottom. Like the icons on top, they too don't necessarily follow the same order as in the progress note itself. From here I can go to surgical history, family history, or I can go back to surgical history. Another way to navigate through the progress note without leaving these screens is to use the pull-down menus here. They'll also take you to different parts of the progress note. For the purpose of this video, I'm going to access the charting screens by clicking on the headings in the progress note itself. When I open a new progress note, chief complaint, current medication, and medical history will already be populated from previous encounters. Other information you see in my progress note: allergies, OB history, surgical history, hospitalization, and family history. That was all populated automatically when I opened those sections up when I was showing you how to navigate through the progress note. So if, for example, I open family history and there's information already there, it will automatically populate my current progress note. Let's start with chief complaint. The chief complaint is automatically populated from the LCR. Add to the chief complaint by using the Browse feature. Choose from the list on the left-hand side by either scrolling through the list, clicking Next, or using the Find feature up on the top. Once you highlight it, it brings it over to selected complaints. You can also put in a chief complaint by clicking Add and free texting on the line. You can remove a complaint by making sure your cursor is on the line of the complaint you want to remove and clicking Remove. Next, we go to the history of present illness. The HPI is for recording the patient's current medical problems. The left pane displays categories and subcategories contained in the HPI. On the right, symptoms associated with the HPI categories are displayed. The tab here tells me that I'm in interim history. If I wanted to go to presenting symptoms, I would click on the X here and choose a subcategory here. When I click on a subcategory, a new tab is created. I can search for a symptom within the category here, but I must be sure that this matches the tab which I'm searching within. In most cases, it's easier to scroll through symptoms using the scroll bar on the right. For each symptom, there's a complains of and a denies field. Click on a symptom, denies, and an X appears. On the bottom, you can indicate patient denies all. Clear a value by clicking the X to the right, or use the Clear All button here to start again. If you click Complains of a symptom, the HPI Notes window opens up. Here it's possible to free text as well as put in more detailed information using the boxes here. In some cases, when you open a category and click on the complains of next to a symptom, the left pane will display a predefined list of options for that symptom. Click on those options and they will appear over here, which you can then edit. Interim history is a place where you can chart without choosing category or symptom from any list. Click on Order Categories, and you can arrange the tabs so that, for example, if you want a particular symptom to be first, in this case I have nose, throat, and sinus first. Now when I exit out of the HPI window, the age and gender of the patient will automatically populate with the complaint. Next we go to current medication. Current medications appear on the same window as chief complaints. This is where the patient's currently prescribed and taken medications are recorded. Click on Current Prescription to view a patient medication summary. You can display 50 at a time or up to 2,000. You can group medications by date or by medication. Right now they're grouped by date. You can qualify the group, so for example, you can look at all meds on a certain date, or if you're grouping by medication, you can group by a kind of medication. You can look at a summary up to the last 2 years or only the last month. And you can search. In this case, I would be searching for a medication, and those visits where that medicine was recorded will appear. A patient's med can be added by clicking Add. Search all prescriptions using Contains. When I highlight benazepril on the left, I get a choice of strengths and instructions on the right. If I want to edit one of these before I add it to my list, I would click the icon here. In this case, if I would add a frequency, duration, and apply. I now see benazepril in my selected prescription. When I click OK, the medicine is here under current medications. If I would like to remove a medication, I would make sure my cursor is on the line and click Remove. If a patient tells me they're taking a medicine but doesn't know the strength, for example, I can click Prescription Name Only, click Add, find the medicine, in this case Tylenol. Doesn't matter which one I choose here because the patient doesn't know what they're taking. Click it, click OK, and then Tylenol shows up on my current medication list, but there's no other information. Interactions will show me any possible interactions between the medicines the patient is taking. We'll be going into much greater detail in the prescribing video. Before leaving the current medication screen, be certain that Medication Verified is checked, as this is a meaningful use requirement. Next, we'll go to past medical history. Charting the patient's medical history is similar to entering information in chief complaints. Click Browse, and the medical history list window opens with a list of predefined diagnosis. Scroll through the list or search from the search box here. Highlight the diagnosis, and when you click on it, it will go over to the selected medical history list. If you make a mistake, put your cursor on the line and use the arrows to bring it back into the other list. The medical history can also be added to via free text. Click Add and then type in what you want. To remove something from medical history, highlight the line you want removed and click Removed. When done reviewing patient's medical history, click History Verified. Patient's medical history can also be brought over from the right chart panel using the arrows. More shortcuts to charting will be discussed in the Templates, Order Sets, Arrows, and Carrots video. Next, we go to patient allergies. Here, the patient's drug and non-drug allergic reactions or intolerances can be documented. Allergies can be structured or non-structured. Structured allergies will always be medications. Making them structured allows the program to link the medications to interactions as well as other drugs in the same class. To add a medication, click Browse Prescription. On the left, you have a list of databases. In the next pane, you have a list of medications and items found in that database. And on the far right, you have a list of the medications that are chosen. Scroll through the prescription list or search using the Find box here. Highlight the medication you want, and it will appear in selected prescription here. You can also add allergies by clicking the Add button. From this pull-down menu, choose Structured or Non-Structured. When free texting allergies, you will get this pop-up alert that says manual free text entry of an allergy will exclude this substance from automated drug allergy checking and may endanger patient safety. But in this case, I'm choosing non-structured. Non-structured will be food and environmental allergies. There are also some hospital-used dyes included in this category. Chart the reaction, and then you can choose whether it's a true allergy, a side effect, contraindication, or just lack of therapeutic effect. In this column, you can chart whether the allergy is active or inactive. It's important to note that this feature should be used instead of deleting an allergy from a patient's record. If an allergy was put in by error, you can remove it the same way you would remove something from Chief Complaints or Medical History. Put your cursor on the line and then click Remove. The allergy log records any activity within this screen. It's another meaningful use requirement to be sure that Allergies Verified is checked. If a patient has no allergies, and here's an example of such a case, you would click No Known Allergies. Allergies Verified automatically gets checked. Prior gynecological diagnoses should be entered in the medical history. Any general information can be entered by clicking the Notes column here. Then you can either choose from options on the left or free text in the screen here. OB history, same thing. Click on Notes and either choose from options if there are any from the left or free text on the right. Surgical and prior hospitalizations are charted the exact same way as Chief Complaints or Medical History. Family history can be charted as non-contributory. You can indicate whether a relative is alive, deceased, or unknown. You can enter a date of birth and the age will automatically be calculated. Click on Notes. You can choose a diagnosis from the left column using the same features we discussed before. Next to scroll, find to search. And when you click on, say for example, if there's Alzheimer's in the family, you can click on the diagnosis and then you can click the number of people in the family who might have that diagnosis. Notes can be added here. Next we come to social history. To chart on tobacco, alcohol, drugs, abuse, neglect, food, security, sexual and contraceptive health, all that should be done in the HPI screen. Notes can be written here. To chart on any of these items, you can click on Details and then choose from the options on the left or free text in the screen on the right. Next we come to Review of Systems. The Review of Systems window is laid out similar to the HPI. In CareLink San Francisco, there are only two categories on the left, the Review of Systems and then the Vision and Hearing, which is for pediatrics. Default observations can be pulled in by clicking on the green arrow. Click on individual green arrows, or you can click Default for All or Default per category. If I click Default for All, it not only populates the charting fields in Review of Systems, but also in the other category, in this case Vision Hearing. If I clear all, Same thing. It clears all the information in review of system as well as vision and hearing. If I click default per category, however, it will only populate in the category in which I am. In this case, review of systems. I can edit a response by clicking on the green arrow again. That removes denies, and then clicking on the notes section here. I can then chart using the list of options on the left or free texting. It's possible to create your own default responses. You might want to do this for example, a frequently seen diagnosis. Use the green pull-down arrow next to default per category. Then save your answers, giving it a name. I've already saved a user's default called test, and when I click on it, the notes section is populated with what I'd put in before. After review of systems, we leave the subjective portion of the progress note and move to the objective part. Under objective, we come to vitals. In the vitals window, it's possible to view results from all the previous encounters. Use the scroll bar to view other vital items on the list. Vitals for this encounter would be entered in the highlighted yellow line. It's possible to free text, but it's preferable to use the pop-up. When using the pop-up feature, information is recorded as structured data, linking the data to growth charts and flow sheets. It also makes it possible to automatically calculate the BMI when the height and weight is entered, which is a meaningful use requirement. When using the pop-up box to enter vitals, be sure to click the arrow here to bring it over to the right. If you make a mistake, highlight and click delete. Then apply, or you can go to the next vital by clicking next. When done, click the vitals taken box here. That will display a stethoscope icon on the office visit screen. In many clinics, this alerts the provider that the patient is ready to be seen. Other options in the vital window is the growth chart. This is used for those who see pediatric patients. And the graphs. Select the vital you'd like to see graphed from the pull-down menu here. Once you leave the vitals window, the vitals will be visible on the chart here with the name of the person who took them. Lab or diagnostic imaging results relevant to the patient visit can be pulled into the past results section of the patient's progress note. This is done from the right chart panel under the DRTLA tab. Once a lab or diagnostic imaging result has been reviewed, an arrow will appear next to it. Click the arrow to pull it into the progress note. This can only be done one time. Once a result has been pulled into a progress note, it will no longer be available for future progress notes. CareLink San Francisco uses the examination screen to chart on patients. Charting on the examination window is very similar to charting in the ROS or HPI screens. On the left, there is a list of examination categories. On the right are fields associated with those categories. Use the green arrows to individually populate default responses. Use Merge Default to add default text to any information already answered. Clear Category removes all answers. Select Default will add text into any observation field that is empty. To add or edit text, click on Observation next to the field. Then choose Options from the left or Free Text on the right. Just as in Review of System, default answers can be saved. This is also true in the examination screen for both Merge Default and Select Default. CareLink San Francisco uses the physical examination portion of the progress note for attending attestation. This is only relevant in clinics where residents are working. The assessment window is where patients' diagnosis or diagnoses are recorded. The left panel contains assessment categories. Search assessments by ICD-9 code or by typing in a diagnosis here. For best results when searching, use the broad assessment category here. Use the pull-down menu to use contains rather than starts with or all words over here. It's possible also to display a list of previous assessments, and assessments can be selected also from the problem list. To select an assessment, click on the diagnosis that you'd like to pick. It'll then appear in selected assessments. It's possible to pick more than one assessment. The P over here stands for primary diagnosis, and that would refer to the current visit. The PL refers to the assessment being on the patient's problem list. Assessments can be added to the problem list by clicking that box. To remove an assessment from the current progress note, highlight and click Remove. Removing assessments this way only removes the assessment from the progress note, not from the problem list. To edit the problem list, click Problem List and use the Add and Remove buttons here. The plan part of the progress note includes how to order for this patient. How to place orders for labs, diagnostic imaging, and procedures will be covered in its own module. Prescribing medications and e-prescribing is also covered in a separate module. Briefly then, when I click on the treatment window, I arrive at the starting point for placing those orders. Patient education materials, a meaningful use requirement, can be accessed from this window. Outgoing referrals is also accessed from the treatment window. Click on Current Prescription or any of the headings here and you'll be brought to the Manage Orders screen. We'll be going into greater detail in the next modules. Click on Procedures to chart in-clinic procedures. Choose from a list of procedures on the left. Use the green arrows to chart default actions, or click Default per category to populate the entire screen. There are some clinics that use the procedure window to chart in-office medications. So for example, albuterol. Now when I close out of this screen, the medication ordered and medication administered are listed. Immunizations can be ordered from the progress note. Click on Immunizations, click on Add. Then the provider can choose from the left column the immunization to be given. When clinic staff sees that an immunization is to be given, they can click on Immunizations, highlight the immunization, click Update, enter the lot number, the date on the viz, the expiration, and then click Me, the location, route of immunization, etc., and then click OK. Now it says the immunization that was given and who gave it. Follow the same steps to chart an immunization given in the past. Simply change the vaccination given in the past field from no to yes. And then you can choose who it was given by over here. Diagnostic imaging and lab reports both bring you to the Manage Order screen that we looked at before. Preventative medicine is not used in every clinic and will be discussed in person. Disposition and communication is also not used by CareLink San Francisco. And the next heading is Next Appointment. How to create a future appointment will be discussed at a future time. Click on Next Appointment to be brought to the billing screen. Here you will see a list of assessments. Here you'll see procedure codes as well. Add the E&M. You can also use the E&M coder if you're not sure what code to use. Depending on your clinic workflow, billing notes, follow-up, and reason can all be used to communicate to the front desk if they're making an appointment. For example, if you want someone to come back in 6 weeks, you can write it here. This will be something that depends on clinic workflow, however. Visit codes and procedure codes takes you back to the same billing screen. One last thing, the buttons down here. Click Close if you are done but still need to go back and chart some more. Click Done if you're completely done with charting. This concludes the charting video. Signing encounters, attesting, and co-signing notes will be the next module. That module will include a discussion of the buttons on the bottom.